Hi, this is Abdul Chaudhary from Starling Diagnostics. And today I'm here with Dr. Nawaz Hussain, also the Medical Director of Starling Diagnostics, as well as Primary Care and Obesity Specialist. Today we're going to talk about the gut health. How does it affect our lifestyle? How can we prevent issues with guts and so on? Nawaz, please.
How you doing? So in order to understand gut health, I think first we have to describe what is the GI tract. So GI tract starts with the mouth, and then it goes to the esophagus, and then the stomach, and you have small intestine, and then large intestine, and then rectum. Each part has its own responsibilities there. So why gut health is a little bit complicated is most of the diseases that we have related to the gut have similar symptoms, which could be abdominal pain, burning sensation, it could be bloating symptoms, it could be vomiting, diarrhea, sometimes constipation. So most of the diseases have similar symptoms. For example, most of us we call it indigestion. What is that? Is they could be feeling abdominal pain and bloating, right? And there are a number of reasons that can happen. There's something called gastritis. It could be gastritis, meaning like inflammation of the gastric wall, like the stomach wall. Then you have infections that can cause like H. pylori infection.
Right.
It's a bacteria.
It's pretty common too, right?
It's very common. It spreads from person to person. Most of the time you acquire it during childhood, but adults can have it also.
And you can just have antibiotics for 7 days. And
so H. pylori found, then you just require 2 weeks of antibiotics. But so how that spreads is like from not washing hands or sharing food that's not clean. That's how it spreads. So that can cause like gastric ulcer also, and then if it's not treated on time, then that can lead to cancer.
How do you know you have H. pylori? What could be?
So these are the symptoms. Like they could be feeling abdominal pain. Sometimes their chain can go to the back. That can be an indication for gastric ulcer. Okay, and if it's an ulcer, you could also have bleeding, and then you could have abdominal bloating, like after you eat, and the stomach gets full.
And you're gassy
and gas feeling because the bacteria produces gas. That can cause this bloating symptoms, and you have increased barfing symptoms also.
What kind of food that you would say prevent from that, or what kind of food causes these kind of things? Right? So it has to do with lifestyle habit, eating habit, and so on. Right?
So gastritis and gastric ulcer sometimes could be due to stress. Okay, stress can cause gastric ulcer too. And then like NSAIDs medication like ibuprofen, Advil, those can irritate the gut, and that can cause gastric ulcer also. And food-wise, bacteria survives on sugar. Okay, so when we eat a lot of carb, it's very good media for the bacteria to grow.
Carbohydrates like rice,
rice, pasta, potatoes, ice cream. The high sugar diet can cause increased growth of. So there's something called small intestinal or bacterial overgrowth. Okay, so what that means is our gut is full of bacteria.
Right.
Okay, these are needed actually. These are not infectious.
They're
bacteria.
good bacteria.
They're good bacteria because it protects the lining of the stomach wall. So sometimes what happens is some bacteria that's not supposed to be there, they start growing and growing and growing, and they become overpopulated, and then in turn they produce a lot of gas. And how they produce gas? When you're eating a lot of carbohydrate, and it's perfect for the bacteria, they produce a lot of gas very quickly, and then it can cause malabsorption. It can disrupt the lining of the gut, and then you could absorb like a lot of toxins that you're not supposed to be absorbing because the lining is not intact.
How does water play into all this?
So water, no direct relationship, but lack of water can cause constipation. Okay, and when you're constipated, the stool or our digestive food is there. Okay, sitting there for too long, and that's perfect for bacteria to grow. So especially people with diabetes, their gut kind of slows down over time. And then their food stays in the body for a longer period of time, and the bacteria grows.
So I mean, you always suggest your patients to drink a lot of water, and it's so many. The water is probably one of the most important one.
Yeah, definitely.
Right.
I mean, if, like for example, diabetes, you actually get rid of a lot of water with the sugar. Okay, so for them especially, drinking a lot of water is very important.
How does what about, like, you know, a lot of our patients have bad odor, or just, you know, if we're talking about people that you hang around, some of them has bad odor, and we may think of something basic like, oh, did you brush your teeth today? But actually this has to do with their gut health.
Yeah, gut health. I mean, if there's too much acid in the gut, that can cause bad odor, you know. And then if there's too much gas, for example, because of bacterial overgrowth, that can cause some bad odor also.
So anything to do with age? Does it have any indication that, you know, if you're over 40, 50, you'll have more of a problem, or?
I mean, the only thing that could be is, you know, over time, you know, your gut slows down a little bit also. Metabolism slows down. That can, you know, cause a lot of bacterial overgrowth as well. But mainly, there's no relationship with age and these diseases, but definitely lifestyle plays a role, because, you know, if you're not eating healthy, then you're messing up the bacteria in the gut, and that can cause all these problems.
So, like, for example, like me, as soon as I eat spice, I have, you know, like spicy food, or like I have stomach, you know, a problem, I have pain and so on and so forth.
Yeah.
Should I avoid it, or?
Yeah, so stuff that you eat and causes symptoms, it's better to avoid. Spicy food can cause a lot of, you know, gastric wall inflammation, and then like chocolate, caffeine. You know, these, what they do is, you know, when the stomach connects to the stomach, the esophagus, when it connects to the stomach, there's a valve like this, okay, so, and that is supposed to be closed, okay, so the food doesn't get back up into the esophagus, right? So, you know, people have reflux. So what is reflux is because the acid is coming back into the esophagus. And why that happens is because the valve gets bigger.
Right.
Okay, so there's more of an opening to go back up, and that happens with because of lifestyle. Obesity can cause that. You know, for certain type of food, caffeine, chocolate, they can cause that. Soda can cause that. Alcohol is another one. So, you know, stuff. You know, eating healthy is very important, not only for these, you know, to decrease the acid, but also to make sure the gut bacteria is very important.
The good, but so even recent studies show that actually gut bacteria somehow is connected to our brain as well, our cognition and things like that.
Right. So what happens, you know, when there's too much bacterial overgrowth, it disrupts the lining of the stomach wall and the intestinal wall, and then you take more of the toxins go into the blood.
Right.
That affects the brain as well.
So how it functions.
Recently, a lot of studies are showing that there's a direct link to it's called, there's a topic called gut-brain axis. So meaning gut is directly related to the brain.
How you're thinking and so on and so forth. Okay. Any last comment about you know, how you can avoid these kind of stuff? I know you've mentioned a lot of stuff already.
Yeah, I mean, so the food, whatever food is, you know, causing the problem, definitely avoid it. But, you know, if the symptoms are not resolving, you should definitely go to your doctor, because there's so many different diseases that can cause same type of symptoms, like malabsorption, like IBS, like, you know, lactose intolerance. All of them have similar symptoms. You go to a doctor.
What is the basic test that you guys do for?
So for you know, one of the tests, say, depending on what type of problem we're dealing with. So if it's a bacterial overgrowth, they'll do like a breathing test to see what kind of gas it's producing, because that produces a lot of gas. So you want to check the, you know, breathing test to see what kind of gas. And then if it's H. pylori, you could be you know, doing a breath test also. If it's a celiac disease, which is another form of malabsorption, there's some blood tests you could do. If it's you know, leaky gut syndrome, there's a different test for that also.
The stool test as well is one of the common
stool
ones.
test is one of the tests to see if there's H. pylori infection. And if they find H. pylori infection, they'll give you antibiotics. And sometimes it's difficult to treat, but most of the time it's treated.
Okay, thank you, Nawaz. We are actually almost out of time. Thank you again for listening. If you have any questions and comments, please let us know. Every week we are trying to come up with topics that relates to our patients, relates to us personally. Thank you, and until next week.